started, Miss Ifat, if you're ready.
Yes, I am. So,
Awesome.
um,
Yeah, we have a lot of participants online. This is amazing. All right. Good evening, everyone. Good evening, and welcome. This is so exciting evening. We have so many people online. Good evening, everyone. My name is Julia, Dr. Goji. I am a member of the Nigerian Mental Health Practitioners USA. It's going to be a great evening. This is our first roundtable discussion. We all know that mental health is an isolated area. Sometimes the discussion around it is very sensitive, but we have pulled all these panelists here tonight. They will just take us home. You know, we're not gonna feel any kind of anxiety to talk. This is a free moment for each and every one of us to share. It's gonna be a discussion. It's not a presentation. Nobody is going to talk about, you know, we're not using any PowerPoint here tonight. We're just going to talk so that some of us will understand the need and the importance of mental well-being. You know, it's something very dear to anybody because we all need it. We want to be mentally healthy so that we can, you know, function and go about our normal life. So before we get started, this event tonight, like I said, is the very first one. We are streaming live on our Facebook. So people are joining us from all over the world. People are coming from Nigeria, from Europe, from here in the US, from all over the world. So we appreciate each and every one of you. Some places is 1 o'clock in the morning. You know, you could have been sleeping, but you chose to be here. We say thank you. Happy New Year. We appreciate you to, you know, tuning in. And it's gonna be a very exciting moment again. Before we get started, I wanna draw attention to everyone about, you know, the agenda. It's a discussion. Each panelist will have a section of the mental health that he or she will share with us so that we can take away something at the end. And while they are talking, if you have questions, you're gonna use the chat button. Miss Ifatu, we have a great IT lady here. She's gonna walk us through. If you can share that so that people can know if they have questions, where to go and how to put their questions. And one of us also, Dr. Achike, is gonna be monitoring our chat. And if there is any questions when somebody is talking, just put it in there. When the person finish speaking, we get the questions. Every single questions will be answered, I promise you, before we leave here tonight. So that being said, before I introduce my panelists, I'm gonna call our able president, Dr. Aliche, so that he will tell us about this organization and what we do and why we are here. You know, we chose this Friday evening, January 28, 2022, to kick off this roundtable discussion, which we have agreed to be doing every quarter. So, Mr. President, I see you. Dr. Liche, if you can please, you know, unmute yourself and tell our viewers, you know, about this great organization before I bring in our great panelists. Thank you.
Okay. Thank you so very much, Dr. Goji. The Nigerian Mental Health Practitioners USA was started in 2018. And this is the first edition of a mental health roundtable. Our goal overall is to help with promoting and developing mental health care in Nigeria, where it is almost non-existent or needs a whole lot of help developing. So what we're doing today is part of the larger community we want to serve. We want to begin a conversation on what mental health is, and the role that every one of us can play in promoting mental health. It's a discussion that, as the moderator has said, goes beyond this particular platform. After this event, we're going to post some of them on our YouTube channel, and it's being streamed live on Facebook today. So we're trying to reach as many people as possible. The idea is to bring some level of education around issues of mental health. So the people you have here today will do justice to that. So mine is just to flag this off and to leave the experts in the room to do what they know to do best. I am confident that they would do it the way that you guys will leave here satisfied today. There is just one thing important to me that I want to leave for the audience today. It's not going to be up for discussion here. Maybe the panelists might mention it, but it was important to me because I am a parent of 3 children who are 17 years old or younger. And I know from the work I do that mental health care or mental health and substance use disorders sometimes have their origins way before they manifest. So what I'm trying to draw attention is a concept or phenomenon that is called the adverse childhood experiences, ACE, adverse childhood experiences. I want everyone who will live here to live with that concept. No matter how much we are able to talk about it now, it will never be enough. So it's something I want you to, look up on your own. And these are experiences that are either traumatic or potentially traumatic to children, and which has long-term implication for their well-being and even their progress, their achievement level. But more important to what we're doing today, a lot of the prevalence for mental health issues in our community have their origins from people who grew up with this kind of adverse childhood experiences. These are experiences that include violence, that include abuse, physical abuse, sexual abuse, emotional abuse, that involve neglect. When these things happen, even as parents, when we fight with our spouses or in some way do other things or drink in a problem where we are setting up our children for difficult time ahead of them down the line. So it's our responsibility to prevent adverse childhood experiences. Like I said, I'm not here today to get down to the details of how this is done, but everything we do, and sometimes the things we do not do as parents, can help either to prevent or promote adverse childhood experiences. And what we do have implication for our children and for our society down the line in terms of what kind of mental health issues that the society will have to deal with. Again, I'm leaving it to the panelists to come back to what they have to talk about today. And I'm grateful that they accepted to present or to be on the panel. And I'm very pleased with everyone who is here to honor our invitation and to join this conversation. Like the moderator said, What we have to do is not a presentation, it's a conversation. And everyone is encouraged to be part of this conversation in the interest of our society. Thank you all and welcome to the event. Thank you.
Wow, thank you so much, able President. We appreciate your leadership, and you have highlighted a lot of things that's enough takeaway for people to go home, but we're not gonna stop there. I just wanna add that in this organization, we have clinical psychologists, we have psychiatric nurses, we have psychiatrists, so that's why the name is encompassing, Nigerian Mental Health Practitioners USA. So again, we appreciate you. Mr. President just told us that in Nigeria, where all of us, every single member of this association is a Nigerian, we also have some members we adopted, and that's okay. Is mental health is non-existence. I'm a nurse, and as a nurse, if it is not documented, it's not done. If you go to World Health Organization website atlas, you don't see Nigeria. Not to say that they're not doing anything, because I know that we don't have enough, but we have a few, psychiatrists, clinical psychologists, psychiatric nurses that are doing something. But because it's not documented, the whole world thinks we are not doing anything. So I'm glad we as diasporans, we have started something that will, benefit our home country. So that being said, I want to introduce our able panelists, and I'm gonna give each one of them just 1 minute, because the profile they sent to me, if we start reading it here, we're not gonna leave this place. So I'm gonna use the power our president has given me to tell them to please use 1 minute to introduce yourself. You will tell us who you are, what you do, and how you came up to be part of this panelists. So I'm gonna start with Dr. Ngozi Okoso. I know her too well, but I know many of our participants doesn't know her. So Dr. Okoso, can you please use a minute to tell us who you are and what you do?
Thank you, Dr. Julia. I appreciate this. My name is Ngozi Okose, and I'm a psychotherapist. I'm in private practice in Houston, Texas. This year, I actually have lived almost 3 decades in the United States. But my journey through mental health started in Nigeria. I actually trained from Nigeria, University of Nigeria, Nsukka, University of Ibadan, and then Harvard University. And I've been very passionate about driving mental health issues. That's really my passion. So I've been in practice in the US for almost 20 years now. And I'm so glad to be part of this team. And as far as mental health practitioners in the USA is concerned, I am the chair of education and training of this noble organization. And I'm very, very happy to engage with you all today.
Wow, I told you, thank you so much, Dr. Okoso. So I'm gonna go to Dr. Julia Hankerson. Please, can you, use 1 minute and tell us who you are and what you do?
I am Reverend Dr. Julia Hankerson. I am a licensed clinical social worker and have been for about 35 years. I have a bachelor's degree from Lincoln University, which is a HBCU, a master's in social work from Rutgers, and I have a doctorate in theology from James and Jesse College of Theology, a small college in Philadelphia. I actually am semi-retired, and I met the president of this organization. He's a social worker, and we met at social work meetings. And I'm very passionate about mental health. I actually owned a wellness center for about 15 years. It had psychotherapy, massage, reflexology, nutritional counseling, and a full service beauty salon. And we used all those services together to help people feel better. Now I still see patients twice a week, and I do a lot of work in the community. I've done work with folks, young African-American men who were on parole or having legal problems. And I set up a free program for them and got many of them out of jail into different programs. And a lot of them are still doing well today. So for the last 35 years, I've been passionate about helping folks with mental health issues. We have to start in the formative years, but I've learned that almost any problem that anyone has, we can address and we can minimize the effects. Thank you.
Wow, thank you so much, Dr. Hankerson. We appreciate you. Professor Ekene Nkwadum, please, can you use a minute to introduce yourself and tell us who you are and what you do?
Good evening, good morning, and good afternoon, wherever you are in a part of the world.
Yes.
My name is Professor Ekele Afansu Sungwadong. I am so happy to be here with the conversation Litia and I started like 3 or 4 years ago, but to realize it to this magnitude, I cannot be prouder of us being here. I have my bachelor's degree in sociology and political science from North Carolina State University here. And then my master's from, actually 3 masters from Capella University, for University of Phoenix, and from, what's this, Campbell University here in North, and then my doctorate from Capella University from Advanced Human Behavior. I have taught in the University of Manali for psychology and sociology for over 15 years. And in my passion for being a scholar practitioner, I decided to leave the classroom just 2 or 3 years ago to be a full mental health practitioner in the field. So what I have taught theoretically, I practice in the community. And this organization has given me a fulfillment. And I am a member of the board and also a member of the committee for policy and education, and also a member of the fundraising committee in this association. And also a board member in Nigeria, because this organization is already registered in Nigeria too. And as we go into our discussion, you will find out how we want to impact that, because this organization is going to be a trailblazer. I believe that. So I'm happy to welcome everybody here. Thank you.
Wow, I told you all, I couldn't have said all this about our panelists. And then my humble self, Julia Dr. Goji, I am a mother of 5. I'm a nurse administrator, currently a dean of nursing and health professions right here in Minnesota. Also a community leader, and I am part of myself and my friends. We have a foundation called Peace Global Health Foundation. We, provide education on mental health. So you can see how passionate this topic is, very close to me. So I'm gonna leave it there. That's, a little bit about myself, and I'm serving different professional organizations and in different board too, as well as this our great organization. So before we kick off the discussion, I would like our IT director, Ms. Ifa, to please play that little click so that it will, kick people in, our participants, while we are here.
By now, you've seen the public service announcement, heard the plaintive music and the plain-spoken message.
Kicking the stigma, environment changed.
The Colts Kicking the Stigma campaign is part of the NFL's My Cause, My Cleats effort. It's designed to raise money and awareness about mental health. The Colts have already earmarked $4 million in donations and will schedule fundraisers for mental health advocacy groups soon.
Awesome, awesome. This is so soothing, Thank you so much, Ms. Ifat. We appreciate you. So I'm gonna kick off the discussion by quoting what American Psychiatric Nurses Association said, which I'm a member of that organization. In 2018, they put out a quote and said, whole health begins with mental health. Whole health begins with mental health. And I strongly agree and believe in that. We are here tonight because we all understood that the need and the importance of mental well-being. We're going to share some of the things we can do so that we don't get to the other, lane. I call it a lane. This is mental. Everybody is supposed to be mentally stable. That's why mental health is very critical. I remember over 30 years ago when I was doing psychiatric nursing in Nigeria at Aba Psychiatric Hospital. I remember one of our instructors said, everybody is mentally sick. It depends on the degree. And there's nothing wrong with that. There's absolutely nothing wrong with that. So what is mental health? According to World Health Organization, they define mental health as a state of well-being, where an individual or every individual, reaches their potential. You're expected to cope. You're expected to be active in the community you serve. You're supposed to be functional, contribute fruitfully, to your community. There are some people, when you walk with them, it's either their way or the highway. It shouldn't be that way. You should be able to work with others. You should be able to live with others. You should be able to contribute. We are contributing tonight. None of us here is being paid for what we are, we're going to spend about 1 hour to 2 hours here. We volunteer to do it because we understand the need. So, which means we are mentally stable, don't we? Yeah, we are. Because there's no argument when, the executive put together this thing and say, who is gonna do it? We volunteer because we understand the need. We didn't stand there and say, what about you? Who is that? It's either my way or your highway. So we're contributing, fruitfully to the community by volunteering. And I want also people to understand that mental health has no barrier. So I have described what mental health is. Why is it important? It's important because you want to be normal. You want to function like a normal person. It's important because if you don't have a good mental health, then you are on the other side of the lane. That is the mental illness, which is also not a bad thing. It's like any other disease like hepatitis. It's a chronic, mental illness is a chronic disease. There's nothing wrong with that. If somebody is diagnosed with depression or with schizophrenia, there's nothing wrong. What is wrong is when you're diagnosed and you don't do nothing, which is why this organization is very critical, especially from the country where we came from. In Nigeria, who are you to open your mouth and say you're stressed? I have anxiety, I have depression. You'll be isolated. So because of that stigma, nobody says nothing, even if you're dying. Because you want your children to get married. Because when you open your mouth and say, oh, that family, they have depression, that's the end of your kids. But it's not like that here. I have, I teach both graduate and undergraduate program here. Students will tell you, you know what, Julia, we have depression in my family. They say it and just, you know, I'm going to therapy tomorrow. I can't be in that meeting. I'm not coming to school. But where we came from, you can't say that. The community will, you know, put you on one end. That will be the end of your family and generation. But things are changing. You know, we're trying to change that concept. That's why we are here, to tell people that it's okay when you don't feel well to say it, you know. So why is it important to say it? Because mental illness has no barriers. You could be 6 months. I used to work in Washington, D.C., you know, in a psychiatric hospital for kids from 6 to 11. I was crying every single day. From there, you see them, you can monitor a child, I'm telling you, until they are 30 or 40. From that children unit, they go to adolescent unit. From the adolescent unit, you see them in the adult unit. From the adult unit, you see them in the trauma unit. Sometimes I couldn't handle it again. That's one of the reasons I resigned. Because we thought it's a joke. It's no joke. So mental illness has no barrier. We call that, you know, the prevalence. It has no barrier, you know. It doesn't know a rich or a poor person. So this is why, especially with what is going on now with the pandemic, we really need to address our mental health issues. If talking is what you think will help you, please talk to somebody. You know, I tell my students, you don't have to go to CNN, but you can talk to somebody, you know, before it gets out of hand. So with that little introduction, I'm gonna move over to Dr. Okoso, and she's gonna tell us, you know, what are when you move from the normal, which I have touched a little bit, you know, when you go to the other land, the abnormal side, what are the things you need to look out for? What are the things you see, you're like, something is not right, you know, even as parents, you know. She just turned 18 years old. When she was going to school 1 year, you know, she stayed home for 1 year. It wasn't fun. She was busy, you know, when you say busy, doing nothing, busy, but she couldn't handle it staying still like me. I had fun working from home, but she didn't have fun. You know, I said, no, this cannot happen. I'm going to get her out. She can go get a job. She can do something, you know. So with that, Dr. Koso, is all yours. I don't know if we have any questions. Is anybody, any comments? Otherwise, we want to hear from you. What are the things we need to be looking out for?
Thank you, Dr. Gaji. You just nailed it. Mental health has no barriers. Whether you're a child, whether you're an adolescent, whether you're an older adult, no barriers. Whether you're rich, whether you're poor, no economic barriers. Whether you're from third world country, fifth world country, first world country, no barriers. And the thing is that in mental health, you see how closely human beings are interconnected. We are really the same, irrespective of where we come from. Socialization, our environment can tweak a few things, but at the end of the day, the pain we feel is the same for everybody. How do we know that, you know, something is not going very right? When I talk about it now, it might look like I'm all over the place. I'm going to be all over the place because what the science for me will not be the science for you. So I'll try as much as possible to pick out, and some of them sound very, very unserious, but they lay strong foundation for serious mental health condition that might start later in life, or later in the months, or later in the years. How do we know that we need to watch out for something, or either within ourselves or with our friends or with our children or with our parents? Don't we all go through those times when we have rough times, when we have tough times, when we lose hope, when we feel like nothing is working anymore, when the future looks very bleak and when we feel lost, most of us go through that, whether we're in Nigeria or we're in China or we all go through that. Sometimes we feel like we are cursed and that we cannot progress. Yes, sometimes when we see, I'm cursed, my uncle did this to me, or they sent witchcraft to me, we think it's Nigerian thing. No, it's not. It's the same thing all over the world. I'm lucky to have my practice gone global, so I talk to people from all over the world, and you'll be amazed to see how those of us in Haiti, those of us in South America, those of us in India and China feel the same way. In the United States, yes, if you doubt it, go to Louisiana. Everybody has a generational curse, one way or the other. There's something responsible for what is happening to them. So that's not just Nigerian affair. So when you start feeling this way, it's all part of when we need to take a step back and say, maybe I need to talk to somebody. Sometimes we feel very helpless. And when these things happen, some people can press on, but some of us cannot. And that's why we are here. And that's why this is going to be a series. So please, for most of you here, just watch out. We're going to be coming back to address some of the issue. This is just the introduction to the series that is going to happen through the year and over time with us. Don't we sometimes see those days we don't want to get out of bed? Or we don't want to go to school, we don't want to go to work, our children just don't want to take their bath, or we don't even want to take our bath for days on end. And, or we don't even know what we want anymore. We are so confused and we don't even know what we need anymore. We lose sight of our strengths. All we are seeing is our weaknesses, what's going wrong. And we kind of ignore everything that's going right. So we now develop this process of negative thought. Everything is negative. Nothing is good enough around you. We are overcritical of ourselves and overcritical of people around us. And we continue to focus on our weaknesses. And as we do that, sometimes we don't even recognize ourselves anymore. I've had clients that will look back and say, I used to be this, I used to be that. And even many of us in Nigeria, I started my work as a lecturer at the University of Nigeria. That was my first attempt at employment. And I was privileged to meet many students who were struggling. And many of them will talk to you about, getting here. They've become so confused. They don't even know what is happening to them. That confusion is there. And they will privately come and seek to talk to somebody. That's why I feel what we are doing today is very, very important. It's going to resonate with so many people because people want help and people are hurting. Sometimes we panic over nothing. Every little thing, we find it difficult to concentrate. And not just that, you just suddenly lose appetite. You don't eat, or you eat too much, or you find yourself not sleeping, or you start sleeping too much. You don't even want to get out of bed. Then you pull away from friends. This is somebody who used to be sociable. Every day you call that person, oh, I'm not interested. I don't want, it's too much. I don't want. Yes, I understand it could be too much once, twice. But when it lingers on, please get close to that person if it's your friend. Get close to that person if it's your child, your parents, please. Something definitely is not going right. And sometimes we wake up with very low energy, and we feel numb. Things around us don't matter anymore, I was in Nigeria, I just came back, and there's somebody that I met, all of a sudden, somebody that used to dress and do things, all of a sudden, those don't matter. You talk to these things don't matter anymore. All I want is to live for God because these things are not important anymore. The relatives say, no, something is wrong here. Please, Ngozi, let's talk with this person. So Nigerians are open. They are beginning to be open because with the pandemic, we've been highly challenged. So everybody is trying to jump on board. And one thing they are seeking is information, just like we are doing. sometimes we are very confused, forgetful, edgy, angry, upset, worried, and scared over nothing. And you're telling people this is the way, and they don't see, but what's that? Why are you angry about this? It might sound like, it looks like everything is a mental health challenge. As I list them, some of us can cope with all this. It becomes a mental health challenge when it starts impacting our functioning. That's when we need to watch out. But if I feel tired getting out of bed, I still get to bed and I still get to work and I work, that's okay. But if you feel tired getting out of bed and you always go late to work, or you are always upset by what happens around you with your colleagues, like Dr. Alicia mentioned, relationship is a major, it tasks our mental health majorly. And that is one thing we have to pay attention to, especially those of us Nigerians who don't feel that relationship conflict impacts people's mental health. We don't think so. After all, you know, if I might translate it in English, I'm sorry. You know, after all, the husband just hit her. Is that a big deal? What's the big deal about that? But that husband that is hitting actually is the one to me that has a problem. Okay. In Nigeria, when we don't think that people who drink, that alcoholism is a mental health problem. Is somebody who makes her to drink, you know, it's like, so when that person starts drinking, it's a warning sign. Please let us jump in at that time and make sure it doesn't go too far. You know, sometimes we yell. I know we have a loud voice. We are very expressive physically and emotional, but we know when it gets out of hand, when people get into fights very easily. Either as a family, you can see family having meeting, all of a sudden people will break into fights and it becomes good fights. And then some people will not talk to their siblings for years. Before I thought it's an Oyibo thing, I realized that it's happening in our community in Nigeria, overseas, in diaspora, and people who live in Nigeria. It's beginning to happen a lot. So some of these things are things that challenge us. Like I've mentioned, relationship is major, and I think we will talk more about it over time. And when you have persistent thoughts that something is going to go wrong or something is wrong in your mind, and that thought continues to play over and over without letting go, and you feel like, one of my clients will say, when it comes, my brain goes and I can't get out of it. That is now a serious situation. Or when you start hearing voices or believing things are not true, believing things that are there that is not there, that becomes a more serious situation, and we have to think about it. When you think about harming yourself or hurting yourself, then it becomes very serious. Or overall inability to perform when your functioning becomes impaired. I will stop here, and I will take questions, and I hope other people can join in this conversation about some of the possible signs that we can have that will alert us to know that it's time to take control, be mindful, be intentional, and see how we are coping with this. And once we feel we are not coping, it's time to talk to somebody. And seeking mental health help sometimes could actually be taken care of by your friend, or by your mother, or by your grandmother, or even by your child. So let me hand over back to Dr. Gorgie, and then we'll take it from there.
Wow. See, I'm only shaking my head. Wow, wow, wow. Wow. Professor Mwadom, do you have anything to add to what she has said? I know she has said it all. Do you have anything to add?
Oh my goodness, yeah. You know, Ngozi nailed it,
Mm-hmm. She
and
did.
you know, when she was talking about relationships. You know, it just struck me because I have tons and tons of people talking about how their parents push them into relationship they are, and they're not happy, and And they don't know what to do because they have so much respect for the parent. They can't say no to them. And because of that, they're stuck in their own mind that there's nothing they can do. Yes, you seek counseling, you talk to somebody. And our people are not used to doing that. They feel there's some stigma that comes with it, you know. They feel like, why will I tell this person this? Because somebody else may hear it some other place, or they will know about my story and all that. So there's nothing to lose. Don't feel ashamed that we all are in this together. We all are in this together. So it is a very, very good thing. But I know this is not my segment, right? The question I asked is not my segment. It's just to say what you want to say because
Sure.
Okay, great. All right. So Ngozi, you did well with that.
Yes. We have a question on the chat. Before I get to that question, Dr. Hankerson, you have anything to add?
Well, I just thought that was excellent. And I really liked the examples that she gave. She really went into real life situations. And that's what folks have to know is that this is real. It happens in their life and there's help for them. When they recognize that they don't have to be ashamed or afraid, there are people here that can help them. Awesome. So I thought it was excellent.
Thank you so much for those contributions. We have a question in the chat that said, Dr. Koso, anybody can answer it. Is corruption accepting or demanding bribe mental health problem? I know Dr. Nkwado has so much to say about that. Anybody can answer that question.
I think either Dr. Nkwado or Dr. Julia will have something to say about it.
You know,
that's a major risk factor.
Yeah, it is. Let's give Dr. Nkwado 1 minute to answer that question.
Yes, I'm going to tell you a story. You know, I wish my father-in-law is here. I'll tell you. I didn't get a chance to enjoy him longer because a few years after we got married, he passed. And I met him. He was a great man, very principled man. He worked in the Nigerian Port Authority. You know, people that ship containers from here. When he lands in Lagos or Apapa or Tinkan Island, you have to go through him to clear that. And you know Nigerians, when the custom people seize your goods, they're looking for a way out to bail it out, to take it out. So people will come with bags and bags and bags of naira to my father-in-law to help them get it out. And he would tell them, look, I don't take bribe and I don't give one. You have to do what the government says you have to do. And people will bypass him to go to another place, try to do one whatever, but he will stick to his gun. He doesn't give bribe, he doesn't take one. And he says, whether you're a giver or a taker, both of you are committing the same atrocity. They're committing the same thing. So yes, bribery is not good, it's corruption. And I'm gonna get to it because it's a mental health issue. It's a mental health issue. I'm gonna get there. But it's a bad one.
Yeah, doctor, I know you have so much to say about that when we get there. I just want to comment that, you know, when you do something for somebody and the person to come around and say thank you, that's nothing wrong with that. It's not a mental health. But when you are taking the 10-20% instead of doing the job, you want the money to go into your pocket, you won't even use it. I think something is wrong with that picture. So, okay, thank you again, Dr. Okos, and thank you all the panelists for all the great contributions. So we move over to Dr. Julia Hankerson. Now we've had what, you know, mental health is, the prevalence, what are those things that you see them, you begin to wonder, something is not right. So what are the risk factors?
Well, this is a really important part of identifying mental health because folks don't really know when they have a mental health issue or what causes it. So something may occur in their life that's very significant and they don't recognize it as something that they need to get help for. So these are called risk factors of mental health. And a risk factor of mental health would be any issue or situation that occurs in a person's life that increases their chance of developing a mental health issue, such as anxiety or depressive disorder, or something even more significant than that, or more difficult than that. One of the most common risk factors that we talk about all the time is trauma. And trauma in a person's life is something, a deeply distressing or disturbing experience that they've had occur in their life. And these can occur early in life or later in life. Our president was talking a little bit about childhood and some of the situations that occur in childhood. Well, in our formative years, we develop a foundation for the rest of our life. There's a book that's entitled, Everything I Know I Learned in Kindergarten. So from years 0 to 5, we learn more than we're ever going to learn again in our life. But some children, they are subject to abuse during that time. And that could be sexual abuse, physical abuse, emotional abuse, neglect. These are risk factors in the early years of life. And when we see they affect children later in life, and if not corrected, it really carries on throughout a person's entire life. For example, let's say, look at a child that's been abused in any of those ways that I'm talking about. Some of the things that can occur is that they'll have, maybe in school, they'll have behavioral issues or learning disabilities that directly can be correlated to abuse that they had early in life. Also, when a person has been sexually abused, this can cause not only relationship issues, but promiscuity, prostitution. So we often have difficulty talking about these issues when they occur, and they occur in a very large majority of people in our society. And these are issues that have to be addressed. And if they're not addressed, then we will see serious mental health issues later in life. Another risk factor is a child witnessing domestic violence. Some don't know that when your children witness you fighting at home, later in life, they develop mental health illnesses and they don't even know where they came from. Many have anxiety issues, panic attacks, and they have no idea how they got it. And if you do a psychosocial assessment and go into that person's history, you'll find that their parents fought when they were young. These seem like minor things. And oftentimes what people do is they don't pay attention to them. They don't think they're important. But when you find issues in a person's life later, you find that they're directly related to these issues. Another one that I thought was really interesting, a risk factor for early in life, is bullying. Bullying in school. Do you know that it's over 95% of the people who are serial killers were bullied? That's a very, very important risk factor that has to be addressed early in life. There are other risk factors that occur in all of our lives. Death. You know, some of us have difficulty when there's like an accidental death and you have no idea that this is going to happen and it happens like immediately. That's very difficult to get over. and it causes emotional stress, needs to be addressed. Loss of a job. I was watching a show the other day, and a person got fired from a job and went and jumped off of a bridge. These things are very serious. A loss of a relationship. Well, this causes not only anxiety and depression, but oftentimes suicide and homicide. You know, you've heard in situations where a person loses their relationship and they kill themselves and the person they were in a relationship with, or someone tries to leave them and they kill themselves and the person that they were in a relationship with. So loss of relationship, that's a risk factor for mental health. Loss of material goods in a fire. That person needs mental health counseling right away when they lose something like that. Loss is very significant because people oftentimes don't know how to get these things back, don't think they will ever get it back. Of course, we as practitioners know that things fall apart and you can put them back together. But that's what we have to be able to help another person to understand. A serious illness such as cancer needs to be addressed. COVID. I've had many patients who have come into my office because COVID has residuals that follow them after they've had COVID, and they don't know what's happening. Sometimes it's one thing is called a foggy brain, but also now it's determined that they have heart issues. So there are issues that follow people. There are illnesses. When folks have illnesses, I remember when HIV or AIDS came out, folks had no idea. They just immediately thought they were going to die and they needed help. They needed mental health help. They needed assistance. And there are many others, such as, I went over most of them. use of alcohol and recreational drugs, any type of substance use or abuse. In all of those situations, those are all risk factors for significant mental health. Oftentimes in substance abuse, I have a hard time recognizing which came first, the chicken or the egg. Was it the mental health that caused the substance abuse, or the substance abuse that caused the mental health? But the significant factor in the conversation that I'm having is that these matters need to be addressed. We have to make mental health something acceptable in our communities so that folks won't just ignore issues or try to shove them under the rug or try to act like they don't exist, but actually go to someone who can help them to address these issues, because all of these issues with proper mental health intervention can be minimized, corrected, and oftentimes eliminated. Thank you.
Wow. 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 Thank you, Dr. Julia. Thank you so much. You have, highlighted a lot of risk factors. I want to add that there's something in the chat. I'm going to address it very well. Let me, before I lose my thoughts. There's something you said about the risk factors. You mentioned about the genetic factors, the chemical imbalance in the brain. If you have such issue, not from, you can have chemical imbalance from drinking, like you mentioned, substance abuse. But if by nature of you were born in this family, which you didn't commit any crime to be born in that family, and unfortunately the family has a history of mental illness, there's nothing wrong with that. What is wrong with it is not doing anything. Mental illness is a chronic illness, chronic disease, just like hypertension, diabetes, cancer. When you have any of those, what do? You treat them. But because of our culture, when people have mental illness in their family, instead of addressing it, treating it, putting them on medication, like you take your blood pressure medication, cancer medication, diabetes medication, We ignore them, and then it moved from acute to chronic, you know? So I just want people to understand that it could happen. You could be born in a family, you know, that have history of mental illness. It's not a death sentence if you address it, you know? So thank you for, you know, mentioning that. I'm laughing here because when somebody said non-payment of salary in Nigeria, that is huge. It's an abuse. Dr. Hankerson told us about emotional abuse here, right? You're gonna hire somebody and you don't pay them. What do you expect? They go crazy. I left Nigeria over 30 years ago. My 2 months salary is still in the hand of whoever that my employer was. You know, that's an abuse. You know, you traumatize people. Meanwhile, remember we were talking about somebody wrote kleptomania here. If bribery and taking money, is it a risk factor? Of course, it's a problem. It's a mental health issue. You know, you hire people instead of you to pay them, you go ahead and dig a ground and you put in all the money. You know, you work in Nigeria, your salary is in Nigeria, but you have a dollar account that you can pay 1 million people. Nigerian population is how many? 270 something thousand. That amount of money in somebody's account. That's mental illness. You're sick, you know? And kleptomania, what is that? Selling things you don't need. You even not going to use them. That's the simple meaning for kleptomania. I learned it how many years when I was doing psych in Aba? Over 40 years ago. Stealing things you don't need. You're not going to use them. So thank you for bringing that point. You know, it's well noted. Yes, many of our leaders in Nigeria, I just pray for them, for God to help them, because you know, it's not fun, you know. So another thing we need to look into very well is emotional abuse. You know, we all mentioned it in relationship, domestic abuse. It's not even about those two grown men and women. It's about those little kids who didn't apply to be born in that family. Our president, you know, spotlighted that from the beginning. Those kids didn't apply to be born in your family. They didn't commit any crime to be born in your family, but you have subjected them to eternal punishment, emotional trauma. You don't see it, but the person is dying. You know, so it's huge. I don't know if Dr. Koso, Dr. Nkwado, you have anything to add, because our IT director is gonna give us one video before we move to the other level of our discussion. If you have anything to add, please go ahead and share with us. Otherwise, our IT lady will give us something.
Okay, let me just add a little bit. As we are talking and we are listening, we have to realize that there are a segment of the population that is more at risk than others. As we have identified, children, women, members of communities that are more vulnerable, especially from Nigerian situation. And we have to pay attention to that. We have LGBTQ members of Nigeria. Unfortunately, Nigerians are not accepting, but you know what? It's there. And many of these children are also hurting. And we also have to pay attention to that kind of gender or identity confusion, because many of them are going through that process. It clutters their mind and it puts them at risk. Also, homelessness is part of being at risk. Unemployment is part of being at risk. And if we look at all this, we see how our community in Nigeria is highly at risk, especially for our youth. So it's not just when we have issues at home and things like that. There's also societal problems that will also put many of the citizens at risk for mental health problems. And we also, on a personal level too, when we feel some form of a betrayal or rejection or unjust treatment, some of us, especially immigrants in the United States, we feel that a lot. It kind of puts us in a terrible mindset when we feel that oh, I should benefit from this, but because of my name or because of my status or because of this, I cannot. So all these things put us at risk. And if we have anybody going through that challenge, that's the time for us to render support.
Wow.
And please, somebody has is something risk. There's something that I missed. Excessive, reckless behavior.
Risky
I did not
behaviors.
yet. Risky behavior.
Behaviors, yeah.
Like Dr. Gorgi mentioned, acquiring money that you don't need, or you just come and live in American bank and then you die and America will take it, or Swiss will take it, or those, and then you deprive people. It does not show somebody who is healthy emotionally. So, and also excessive want like gambling or excessive sex or anything in excess. Like we always say, too much of everything is not good. So when you see somebody, oh, our people can kind of try to minimize it. Hey, he likes women. But you know what? It's a sickness. Whether we like it, it's a sickness. Yeah. Oh, he likes women. Hey, that one. They take, I see women. But it's a sickness. And the sooner we start yelling that out to let those people realize that they can do better. Because people that do that feel a lot of void within themselves. And they think they can prey on others to fill the void. And they don't feel the void. And the more they don't feel it, the more they want to engage in that behavior, thinking it will help them, but it never does. So if you see people doing that, just tell them whatever they are planning to achieve, they can't achieve it through that means.
Right. Thank you, Dr. Kosa. I want to read out something that is cutting my eyes here from the chat. Somebody said, I read that there are only 250 psychiatrists in Nigeria serving over 200 million population. That's absolutely correct.
That's correct.
And the last time I checked, the Nigerian population is 270 something million. We have less than 200 psychiatrists, giant of Africa. It's a big problem right there. So because we don't recognize that there is need, that mental health is an issue. Remember, globally is an isolated area of health, but in our own country, I don't know, what are we gonna say? Isolation plus isolation is way too isolated in our own country, and it's not right. People are going through economic stress. People are going through emotional abuse, emotional stress, a land that is blessed. Some of the leaders are stealing the money they don't need, that they are not going to use. So the risk factor is huge, in Nigeria, in our own country. So that's why this organization is going to be very viable and sustainable. Nobody's paying us. Nigerian government is not paying us. We all contributing, volunteering our life, our skills, our expertise, our knowledge to say, here we are, how can we help? So that is huge, for those who founded this organization. There's something I want to read again. Somebody said, I like the way this conversation is going, emphasis on awareness. Is not having mental health issue that is real issue, but pushing it aside under the rug. That's what we are saying here. There's nothing wrong in moving from good mental health to the opposite, which is the mental health disorder or illness. There's nothing wrong with that. What is wrong is not doing something when you find out that, oh, something is not right. So our able Vice President, Dr. May, thank you so much for bringing that to our attention. Yeah, when you hear something, you say something. That's what we do say in nursing, in CPR. When you hear something, you do something. So
I wanted to chime into this because there's a lot that both Julius, both of you, the Julius, you have mentioned a lot about the risk factors here. And when a society has been abused, you may be suffering mental health without knowing it. And in Nigeria as a whole, as we are planning to bring this awareness to our people, do not know that we have suffered mental illness for so long. The entire society I'm talking about. Why? Because when you continue to maltreat a segment of a whole population, a country where 67% of its youth are unemployed, a country where almost 54% of the entire women do not have even a right to even say anything they want to say in their mind. A country where the leadership, the small minority 1% elite, has entire money. If you look at the government budget, goes to 85% of government budget goes to running the government. And 15% of whatever that is left goes to different segment that doesn't really count for anything. Individuals provide their own power source. Individuals pave their own roads. Individuals have nothing government does, but just to take money and not be able to affect the population. Yes, one psychiatric per 800,000. One psychiatrist per 800,000. Compare that to America, where you have about 28,000 psychiatrists, which you're looking at one psychiatrist for 11,000 people. A huge gap. So from childhood, as a child, at least from 3.5 years moving up, everything that happens in your household is embedded there. It's locked in. You will remember that going forward. And as a child growing up in this society, you are already enslaved in your mind what your life is going to be like, unless some miracle happens and you get out of that system. So we're going to explore more on that. And it is a good awareness that we're creating, because when Alicia and I started talking with the governor of Abia State, who wanted us to do this in their state, he has good talking, but when it comes to funding, he couldn't come up with it.
Right.
He could not. But we said, okay. Alicia said, look, let's leave them alone. Let us do this as an NGO. And we go in, and when we start to doing something good, they will come and sing our praises. But at that time, they will be irrelevant. And that's what we're doing here. So I thank everybody joining us, because we are going to do more. It's a good conversation, the risk factor, Dr. Julia.
Yeah, I want to read what this thing is so interesting. Nena said, is it possible the stigma against mental health is being promoted by the tendency for Nigerian parents to tell their children to suppress their emotions? Emotional intelligence should be talked about too, if the kids are taught how to move through and cope with their emotion rather than how to hide and ignore them. This is a very good point. Nena, thank you for bringing that up. We're talking about our country in Nigeria. Even some of us here, Nigerian parents here, we're not getting it. My sister Dora called me some time ago. I say, Auntie Julia, I'm telling you this because I know you are into this mental health. I want to go look for a therapy. And my mom said, what is wrong with you? That language alone, what is wrong with you? You've cut her off. She can't talk to you again. You remember, you don't go to therapy only when you have issue. Are they giving you medication there? It's talk therapy. So I now called my sister. I said, what do you mean? You complaining she doesn't talk to you. Now she opened up, she wants to talk to you, and you're asking her what is wrong with you. You want her to, I'm not gonna be the middle person. If she talk to me, want to work with me, I work with her, and I won't tell you afterwards, whatever we're talking about. So we parents, all of us has agreed that the first 3, as a nurse, I said the first 10 years of your life matters so much. What you put in your mouth, what you eat, what you see in the family growing up has a lot to tell about your life, so it's a very sensitive time period. We need to, be very careful about that age bracket. I see Dr. Apwaka, her hand is up. Before I will get her question and then we go to that video and then go to the next session. Go ahead, Dr. Ujunwa, Dr. Stella, unmute yourself and talk to us.
Thank you so much, Dr. Julia. I just have to say thank you so much to all of you, the organizers of this beautiful, beautiful, important healthcare issue for all of us all over here in the diaspora and in Nigeria, our community. It's a human right emergency. The mental health situation for us Nigerians and in Nigeria, it's a human right emergency. There's a lot of societal negative attitudes embedded within the issues of mental health in Nigeria. It is something that should not be spoken, should not be discussed or mentioned in families, anywhere in our society. Mental illness is not seen as an important situation because of the stigma that is attached to it. And we don't have resources, we don't have adequate facilities, we don't have enough health care institutions and staff in the country, Nigeria, to help individuals that are battling this mental health situation. Depression, anxiety, schizophrenia, and now with the drug-induced psychosis that we're seeing. So I thank all of you for this beautiful, beautiful organization. And I'm very, very proud. When I received this, I looked at it, I said, I have to go in to see what's going on. So I will continue to participate. And I thank you all again. Thank you, Dr. Julia, for this. It's well needed.
Dr. Apwaka used to be my instructor at UDC many, many years ago. Thank you so much for joining us. We have a great question here before we go to that video from Dr. Oni. Dr. Oni is a clinical psychologist. He said, does the language the clinician use impact the utilization of mental health services? Who's gonna take that question? Anyone? Does the language the clinician use impact the utilization of mental health services?
Yeah, can I talk about that?
Go ahead.
I always feel that we have to be cultural sensitive as we kind of advocate mental health condition, because it's different for different communities. In our community, when we talk about trauma, there's so much that we'll talk about that can induce trauma in Nigerian society. We have their marriages, we have the Boko Haram issue, we have the kidnapping issues, we now have headsmen, and we also have the unknown gunmen. We have, just anticipation of all these people and that has become our language. Now, from my practice, I'll be honest with you, in Nigeria, 80% of people diagnosed in the US with ADHD will not qualify if I'm practicing in Nigeria for attention deficit. Because ultimately, you see them, they have to be kids. So that's another thing. We have advantages in some of our rearing practices, and we also have to be mindful for the language we also use when we approach our own people, and be careful about labeling, because I'll be honest with you, if not because of insurance, some of my clients will not be getting the labels that I give them. And labeling put people off, and put them in a mindset that something is seriously, seriously wrong with me, when it could just be something as simple as adjustment. So Dr. I agree with you. That language can put anybody, or you can put the parents of, you go to see a psychologist or psychotherapist or any mental health practitioner, thinking the person will help you to sift through what could be wrong. Bam, you are slammed with one diagnosis. And it puts, I can see that putting parents off, So I can see that happening, it happens anyway, and not that I can see that, it sure happens, not just in our community, in other communities outside of the Western world. Western world has their own way of doing things. And I've also noticed that we, Indians, Chinese, Asian, South America, we have our own ways of doing things, and we have to bring it in as we discuss mental health issues.
Thank you, Dr. Okoso. So, Dr. Nee, the answer is yes, because communication is very critical in every relationship. Communication is very critical in every relationship. Go ahead, Dr. Kene, so that we can, you have one second.
Just a minute. Yeah.
You have 1 second.
All right. Well, one of my experiences is that I taught in middle and high school here in America for 15 years.
Wow.
And my experience, actually, I developed a program in one of the alternative schools that handles stigma and labeling of this diagnosis, where kids do not want to be in a special education class. Because somebody think, oh, no, those are the slow learners. Those people, these other people over there are the smart ones. And if they could come themselves to that stigma, they don't even want, even that determines their association, their friendship, and other things that it comes with it. So I'm going to change that. Name or definitions goes a long way, because we're talking about mental health. Normal and abnormality is culturally conceptualized. You have to know, when I came to America, when you say somebody is mad, I thought he's a madman, because anybody will talk mad in Nigeria is a lunatic, right? Over here is a lunatic, but if you use the word mad, they think you're talking about a madman on the street. But mad in American language means somebody is angry.
Yeah.
You understand? So language is very, very powerful, and we need to know how to use it.
Yeah, communication is very critical. Thank you so much.
In this international edition of our roundtable discussion on topical issues in mental health and substance use disorder, we have edited out the video clip Mpolo Mmili by David Jones David due to copyright restrictions in some countries by Africori. But the video is excellent. The message is clear. Say no to drugs. Say no to Mpolo Mmili, which has been causing a lot of havoc on our youth, especially in the southeast of Nigeria, Igbo kids. You can watch the video on his YouTube channel as posted on the screen. Thank you.
Wow, that was so soothing. Very soothing. For those who doesn't understand English, we're talking about substance abuse here. We are in a pandemic. You have family issues. Instead of you to address it, you resort to drinking, right? Taking drugs, complicating, compounding the issue. So that's what's that little clip talking about the effect of substance abuse. Thank you so much, Ms. Ifat, for sharing that with us. All right, so we get in there. So we move into the last segment, and that's Professor Nkwadom is gonna take us to that. We wanna know, now that we have had what is mental health, good mental health, we've had what is bad mental health, the opposite of the good one. What are the things you begin to see in your child, in yourself, in your colleague, in your neighbor, and you begin to worry, something is not right. We had all of that from Dr. Koso. Now, Dr. Julia told us the risk factors. We've all agreed, economic problem, genetic issues, whatever we have heard from her this evening, those risk factors. Now we have all these put together. What are we gonna do? So Professor Nkwado is gonna, highlight. I know there are numerous things we can do, but let's hear him and see, what he's gonna share with us. So it's all you have the floor, sir.
Thank you, Dr. Gaji. Oh my goodness. Solutions to this? Sometimes I don't know where we start. America is a great country because they have great laws in place, and those laws can be enforced. And people who disobey those laws, there are consequences for it. We're talking about mental health in Nigeria and solutions to how, if any, that can be brought to that. In 1958, the colonial masters that came to our shores proposed what they call a Lunacy Act. And this Lunacy Act was just to give power to the medical practitioners and magistrates, or the law, what they call the lawyers, the law enforcement, to identify who is a lunatic. And they gave them power to imprison them. And, they combined both criminal justice and mental health together, and they put them in prison, observe them for 7 days. And if that person doesn't act well again, keep him there for another year. And so they gave much power to these two departments of people that can handle that. From 1958, and it goes on, nothing came out of it. Actually, it's not never mentioned. Another time it was mentioned again was in 2003, when two senators that submitted a proposal to amend the Lunacy Act in Nigeria to see if that would be a remedy to what they have proposed. And that proposal by these two senators stayed in the House, didn't even go first or second reading. They kept it there up to 2009. And then another senator signed it and said, well, look, let's withdraw these things. Let's deal with people who are embezzling and taking money, and let's continue to share the national cake. Forget about these people who will die one day, say they are lunatics. So they withdrew that. Well, until some other foreign national keep sponsoring, they said, let's go back to amending this Lunacy Act. And then they reintroduced that bill in 2013 at the National Assembly. And since then, 2013 till now, it has never been heard. And if you look at even the government appropriation to take care of those who are really going to implement this power they gave both the magistrate and the health practitioners, 1%, less than actually 1% in national budget that was appropriated by the national government goes to only the workers, the medical doctors that are doing, not to the people who are suffering though. So since then, they have not even done anything to that bill till now. So if we are going to suggest any solutions, let us start with the legal system. Let us begin to see how we can even put some laws in place to differentiate the Department of Health in Nigeria and create a new ministry, a Department of Health and Human Services, like America has it. And then within that framework of this proposal, the policymakers can carve out those things that the Lunacy Act have suggested that stigmatize who is lunatic and who is not. And when those laws are in place, then we can begin to sensitize and educate and create this awareness we are proposing now to the general populace and say, look, there's a hope that because that's nothing the government is doing, people are even afraid to talk to anybody about who they are, what is happening to them. They are not. Because if you look at the stigma, that was a poll done by EPI Africa that actually polled about 5,314 people. And out of that poll, 69% of the people that were engaging in any kind of mental illness, they wouldn't even talk to them. Anybody with 69% of people said that anybody with mental illness or lunacy, they wouldn't even engage in any conversation with them. Because you could see, if you talk too much, say, Onyala, What are you talking with a madman? Okay, 58% were concerned. People who don't even want to deal with anybody with mental illness, they were concerned about their personal safety. Others wouldn't even have any business with that, about 26% wouldn't even have any business to do with anybody with such type of stigma. So to begin to prefer any solutions, one, we have to penetrate into all the ministries in Nigeria. There's something we call train the trainers, and this was practiced with in Malawi. One of my good friends, Dr. Chasi.
You muted yourself, Professor Kene. Unmute yourself, sir.
Oh, I did. I'm sorry.
Thank you.
Okay. There is a program that was practiced in Malawi. One of my good friends, Dr. Chazima, who was the vice chancellor of the University of Malawi. And this was a discussion her and I had when we received our fellowship, 2015. And this project was taken to Malawi, and it worked, where people like us, organizations like us, sponsored to train the professionals in the field, people like, police officers, nurses, teachers, prison workers, different professionals in different fields. We train them on how to practice or conduct outpatient therapy with their workers and their families. And after that, you come back, those people will continue to train others in the lower level of their own establishment. But we, the professional, have the knowledge and expertise to train these people in different companies. And for what we're doing now, thank God we are streaming this live, because this is a mass communication. When people can learn from speaking in an audience like this, or understand that the awareness is being created that we cannot really rely on government. The only thing we ask government to do is to create the environment for NGOs like us and other people all over the world can come in and help to educate our people on who they are and what they're doing. Like an elephant who has been tied on a particular tree for over 50 years. And then one day, somebody woke up and told the elephant, now you are free, go. And the elephant looked around, and he has been so comfortable in that place for 50 years. He couldn't even make a single step. The elephant was still there. Even though you have untied him, he was still in that spot, never left that spot. So it's going to be a big challenge to untie, because our society has been really abused for over 50 years of mental degradation. We have accepted abnormality to be the norm. From the gate man to the clerk, to the file messenger, to the secretary, to the CEO, to the president, everybody has their own portion of mental illness. Because nobody will ever do anything without asking you for something. That is how bad it has become. So solution is here. We are the solutions. Because as our president can testify, when government tried to pretend like they were going to fund and sponsor, they want us to use our expertise and come home and do it for free for them. We said no. Now we gather ourselves like we're here. We are going to go there. The only thing that we're going to ask the Western world is to sponsor us. Put money in our coffer. We know what to do. Send us the money. Forget about this government and all these billionaires and millionaires. I call them, well, they are not in a proper frame of mind. When somebody has 10 cars in his garage, that is called a hoarding.
That's another type of mental illness.
You have 5 houses, 10 houses in 10 cities. How many of them do you sleep at a time? The money, I won't even begin to that. So help is on the way. We have to provide an outpatient therapy for some of the people we have trained. You know, somebody asked, how many psychiatrists or how many medical doctors in Nigeria? Very, very minimum. We don't have enough. So in order to fill this vacuum, America came up with that because America was shortage of psychiatrists and psychiatry in different areas. What did they do? They went to their board, they, you know, the KCREP, you know, they, and ASCA, national model, and KCREP, they created another thing for the universities to train nurse practitioners to fill in the vacuum, because when you finish medical school, psychiatry is another specialty. You go for another 4 years. So they bridge the gap by having nurse practitioners now in different areas to do the same work that psychiatrists are doing. So we will also approach that, try to go to our universities and amend the training curriculum and catalogs and go in there and help those in social sciences to focus on mostly this healthcare and these areas that we are struggling to do with. Create a certificate, you know, course that they can, it doesn't have to be a degree, create a certificate for that. Assist the families to stop quarantine and chaining and locking their people with this type of mental illness in their backyard. We train them. These are normal people. We are going to work with I call the pharmacist to help us to come up with the drugs, because in America, we deal with all of them. I was in one of the Walgreens, and somebody with schizophrenia was in line trying to collect his medicine, and somebody in front of him was really delaying for him to get his own piece of medicine, and he was just stamping his legs to tell the other guy, please get out of the way, let me get mine and go. Everybody in America has one thing or the other, everybody, but they have medications to manage it. That can be done in Nigeria. Let's work with the pharmaceutical industry to bring psychotherapy and psychopharmacology to work together with our nurse practitioners and psychiatrists and medical professionals to help medicate these people. We can do it. Assist the families to make sure that we provide the assistance and the help they need, to make sure they understand that these people are not really bad. They only have some genetic defects or environmental effect. If you live in Nigeria and you haven't gone crazy, even my visit for 2 weeks, I go crazy on the traffic. That is enough to cause imbalance. So my brothers and sisters, I mean, the list goes on and on. What we provide in here to cure some of these things, some of us that are here, you know, COVID have taught me something. In every weekend, we go out to our communities, Friday, Saturday, Sunday. We have these social gatherings. We go there, everybody eat, you play the Owambe, you play Sonoko, you play Osadeva and all that. You dance and dance and dance and eat and drink, and you go home 2, 3 a.m. in the morning and you crash the next day. You talk about what happened in that thing. COVID restricted us from doing that. But you know, the lesson on that was, when we go out to do and socialize and have this fun, you forget all about all that stress and things that happens to you. You go home refreshed. When Monday morning comes, you go to work again and you deal with your coworkers, and you know, you begin to tell stories of what happened over the weekend. They envy you, they love that. That is another way of dealing with those mental issues. Society or community organizations, they help you. You belong. Do not isolate yourself from your community associations. Join them. Do pay your dues. Conversations, contribute your own point, and go home. Ways of dealing with that. Children, parents, stop forcing your children, well, parents, stop forcing your children to marry who you want them to marry. It is not, look, I made my own choice and I'm living with it. So let them make their own choice. We are so bent into it. Again, something very important in counseling is culture. Culture is what you take with you wherever you go. And I'm telling everybody here, no matter what you do, remember your culture have a big impact on your person. Always remember that. And you can always use all the uncles, are not the bad ones that can say they're your uncles, but they will be looking at you in one eye for another thing. So there are good uncles and bad uncles. Choose the good ones, talk to them about what you're suffering. Avoid the bad ones. If they invite you to their houses, don't go. Don't even, don't entertain that. So there are a lot that I can share about propositions, but this very segment is the beginning of many series, like our Julia said. So we cannot unpack everything today, but this is just a tip of the iceberg. Thank you.
Wow, wow, wow. Professor Ekene Mpadom. You guys can tell he's a professor, right? He started with data, right? Because there is power in numbers. He has listed so much that we could do. We're gonna start from somewhere. Some of the things he has mentioned here, we all came from Nigeria, politics and policy. If we want to be part of it, we may not do much. So we're gonna start from those little ones that we can do. We have started it because people say if you want to go far, you go with a group. But if you want to go fast, you go alone. So we want to go far. That's why we are here as a team. If we want to work with Nigerian government, we may not do anything. I'm a living witness, as a board member for Nigerian nurses in US. We've done so much in Nigeria because we left the government alone. We volunteer ourselves. We volunteer our expertise. We volunteer our money. I just came back from a medical mission in Abia. I'm not from Abia State. I was their keynote speaker, leadership during pandemic. And nobody paid my ticket but me, but it gives me joy because of those poor nurses in Nigeria, because I practiced in Nigeria. So we can do those, we can arrange, we can train the trainers, we can put ourselves together and organize them, leaving the government alone and train them. First of all, we have to start creating the awareness that we are doing so that people understand that mental health is not a taboo. Look at the pandemic. We're going through the pandemic now, is something that is not under your control. Why are you going to be drinking? You can't handle it. Take the vaccine, you will not take. You want to drink and drink and drink and think the pandemic will be over. It will not be over until it's over. So thank you so much for sharing those. While we, plan ahead on how we're going to help our brothers and sisters back home, our own country, because we have seen here, it does work. It works. People come to CVS and take their medication. I worked in many psych hospitals in DC. If you see a Nigerian child, the parents won't even say hi to you. They don't want you to know, but you are the one that will help them because it could be your child. But they will stay away. When they want to visit, they don't want to talk to you, So we have, the work is huge, but we're going to start from somewhere. So as we round up, I just want to start by saying thank you to Dr. Liche, our able president, all our participants. You could have been somewhere this evening, but you chose to be here. We have over 50, 60 people here, listening for the last 2 hours. So I say thank you so much to each and every one of you, all the participants. We couldn't have been here without you guys. We appreciate each and every one of you. If you go on our website, all our information are there, reach out to us. We are all in this together. Mental health is real. We don't have we have the opportunity to be here. We know what to do. I go on medical mission to Nigeria at least once every year. We know how to source for the medications here, to go and help our own people, because there's no place like home. You know, that's why we are here, because we know there is no place like home. So before we exit, I want to go back to all our great panelists, starting with Dr. Koso. You know, 1 second, what is your parting way? You know, what do you have the final thought to all our participants?
Yeah, thank you all for participating. My final thought is we also have to look at what we have now existing in Nigeria as we plan where to go. We notice that all issues of mental health situation is left until the need gets there. And at that point, where do we end up? In churches, in maybe Islamic rehab centers or Christian rehab centers of some sort, or some state rehab centers. And what happens there? They are chained and left there to rot. So these are things that we have to make sure that it doesn't. Some human rights activists have gone to Nigeria in 2019, and they work towards trying to stamp out this chaining. And the President Buhari said he was going to work on it, but I don't know what they have done. So we have to be mindful of that too, that what we have existing now does not work. And we also think about training the trainers. Dr. Ngwadum, thank you on that. We also have to train communities, because communities play major important roles, you know. So if we can get our mothers and grandmothers, people trust those people who are close to them. Let the children know that it's okay if something is happening at home and they feel their parents won't listen, it's okay to talk to aunt, it's okay to, like he said, call that uncle that you trust. So, and I'm really pleased to be a part of this, and I'm looking forward to our second series. I'm sure we're going to have greater speakers during that time.
Thank you so much, Dr. Koso. We appreciate your knowledge, your expertise, and your time. You know, you could have been somewhere this evening, but you know, you volunteering, you know, yourself and your knowledge. Dr. Hankerson, what is your parting word to our participants? Can you unmute yourself, please?
I'm sorry. Thank you so much for having me. And one of the issues that I find so important with mental health is really removing the stigma and bringing people together to help people recognize that it's okay to reach out. And I think one really important part of that team has to be religious leaders in our community, getting them on the same page with us so that they're encouraging their parishioners to get the mental health that they need. So we need to get people getting the help and taking the stigma off.
Thank you, thank you, thank you. Before I get to Professor Ekene, we see our Vice President hand is up. Dr. May, you want to share something? You want to unmute yourself and
Well, briefly, I just want to thank everyone, for coming, the panelists especially, and this mission is real. This is a mission that we have taken on, and then we're asking everyone that is interested to really join us. The main thing I just wanted to say is the awareness. I think that is what is killing us. People are in denial. People don't believe that mental health is real. It is real and it is okay. Just like we respect physical health, we have to respect mental health. The whole body is both physical and mental. And if you're treating physical health and you're suffering mentally, it is still doomed. We have to as well, pay attention to our mental health being. And I'm calling on parents, both here and in Nigeria, to focus on those adverse children, effects, those things that affect children, because early on in your childhood is when you build that foundation, and that foundation is necessary. So this can be something we can take on another time, just encourage people to pay attention earlier on. And when you see something, say something, and help is available. Let's normalize mental health so that we can all be good. Thank you so much.
Thank you so much, Dr. May. I see Dr. Achike hand is up. Dr. Achike, you want to mute yourself, sir?
Yes, please, just wanted to interject that when we listened to Dr. Aliche, the president, talking about ACEs at the beginning of the presentation, it's really important that we recognize that majority of us here have more than 4 ACEs as a minimal, because if you are born from, let's say, 1971, if you are born earlier than 1971 and have been in Nigeria during the civil conflict, whether you were directly affected or not, the generation that's ruling the country since then all have impact of ACEs. And so when people say that people are impacted by mental health, that's a very critical input in the process. The second thing is that COVID has come, and for the first time in my whole life, I've come to recognize that the community has recognized the impact of what they call a mass, either pandemic or disaster, which is what we faced back. That's why people refer to Western Africa as the topography of trauma in the whole continent of Africa before we had the Rwanda genocide and, of course, the consistent apartheid that impacted many of the people.
Dr. Chike, hold on one second. Where is the noise coming from, Miss Ifato?
I'll check. Okay,
good.
muted.
Thank you.
All right.
So that's really my panel, was that we have a big job in our hands, and we can't wait for the government. We take the project and just begin to spread in the communities, because we do really have a very urgent need to put our boots on the ground and continue to do as much as we can to lift our community's awareness and also spread help as needed. Thank you, all the panelists. We really appreciate your contributions.
Thank you so much, Dr. Achike. Professor Ekene, any parting word from you?
Yes, thank you, everybody. I want to leave us with this, all of us. This organization, we need, nobody else will do it for us. Nigeria is ours. And I can tell you that whether we have the money or not, if few as we are here can march down to the National Assembly, and that bill that has been in suspense since 2013, we bring it alive and propose to the government that a separate ministry needs to be created, and we want that done. I can tell you, if you want anything to happen in Nigeria, they listen to foreign people. Especially if you're from America or Britain, they listen. So we have a whole lot of work to be done, and our work is cut out already. We have the niche. So I'm going to appeal to anybody who has a brother who is a billionaire or a millionaire. Please dump your money with Nigerian mental health professionals, because we have work to do. And again, whether as an individual or in a family where you come from, whether you believe that or your mental health problem is by drug, or whether it was a sickness of the mind or somebody caused you, whether it's an evil spirit possessing you, whether it's an act of God, or there is some genetic influence into the way you behave, just know that help is on the way. Help is on the way. The only reason you cannot get help is because you are not talking and you are not using the resources available. And all of these people here are your resources. Please reach out to us and go to our website and you will get the help you need. Thank you.
Thank you so much, Professor Kene. I see Dr. Nwoke hand up. Sir, you want to share something?
Not much. Just want to say thank you to all the panelists. This is very wonderful. I mean, you guys are so good in your presentation. And I hope that we continue this because a journey of million miles starts from the first step. You have touched all the areas, including the risk factors. I've been in Parkland Hospital in Dallas for 27 years, working with homeless. And I mean, you could see it all. Almost each and every one of my clients has some element of mental illness. And it's a huge, huge problem. Not to talk of Nigeria. I just came back 2 weeks ago from Nigeria. I mean, it's a mess out there. We need to do something. Nobody will do it but us. We have to do it ourselves. We don't have to wait for the government. There is no government there. I'm sorry to say that the governor of Abia State is just my younger brother in the same village. Yeah, the governor is from my village. There's nothing there to say, let's rely on the government. It's a waste of time and energy. Let's do it ourselves. Let's just take a step. We will go further. Thank you, Dr. Kene, Dr. Ngozi, and Dr. Hankerson. You guys are wonderful. You guys are wonderful. Thank you so much.
Wow, Dr. Nwoko, I didn't know you from Abia. I should have taken my ticket money when I went to medical mission last month in your state. Thank you so much for that contribution. I see Dr. Mwaguru, our EBO chair. Your hand is up, sir.
Yes, I just want to thank everybody that has showed up this meeting today. I am highly emotionally moved to congratulate all the panelists and all the presenters. I'm very, very impressed with how we started today and how we are ending up. Thank you very much.
Thank you so much, sir. I see Azubweze's iPhone. You want to unmute yourself? I see your hand up.
Yes, thank you.
Okay.
My name is Azubweze Ikejiani.
Yes, sir.
And served as a director, Jackson Memorial Hospital Pharmacy for almost 20 years. Well, I'm just going to make a suggestion, first of all.
Okay.
This is welcome. It's a welcome event. That's number one.
Thank you.
And how do we create awareness? The awareness has to be done minimally by setting up billboards in different places. That's number one. Because we grew up in a system where when people are deemed crazy, you just lock them up and throw away the key. I happen to have grown up with some of them, to be honest with you. Some of them I took to hospitals in Enugu, the psychiatric hospital. Nothing was done. So we have to begin to create an awareness what mental health is. And I propose educating the masses to be able to identify this. Not just running to churches and stuff, because that doesn't do us any good. People have to be willing to actually go see somebody to explain what's happening to them. And if possible, apply some medications, because that's how it's done here. I've seen it happen so many times. And I watched a video about Mpurummiri. Mpurummiri is an addictive medicine, and it has a cure. I can tell you that right now. In fact, I'm working on sending some to Nigeria, the medication itself, to be able to get them out of addiction. Thank you.
Thank you so much. Thank you. Thank you. From my humble self, we're rounding up. We had what everybody said. This is an organization of learned men and women. We know what to do, and this is just the beginning. We're gonna do it right because we know what to do, you know. So we registered this organization in Nigeria last month. So we don't wanna jump any hole. We're gonna, you know, plan it well, you know, and move to implementation. God's willing is going to come out well. We just need everybody's support, you know, whatever you can contribute, yourself, your time, like we all did here tonight. Like I stated from the beginning, this is a quarterly event. This is the very first one. So you look out for our information from our Facebook, from our website, you know, reach out to whoever that invited you this, because mental health is real. Again, American Psych Nurses Association said whole health begins with mental health. Everybody is echoing that creating awareness is the first step, because we came from a culture where the stigmatization is so huge that people don't believe, you know, mental illness exists. And we're telling you that it does exist. And we're going to help, you know, to the best of our capability to see what we can do. Education is another team that is running here, you know, training people, training the trainer. We will do all that, you know. They said a step of how many million begins in one step. We baby stepping now. We're gonna, you know, speed it up, you know, and do the best we could, you know, for our own people. So I see many other hands. We've kept people here for 2 hours. I don't know. I think everybody is happy to stay though. I see Dr. Ruth. Dr. Ruth is one of our own also. And she also has a foundation, you know, that address mental health issues and suicide. Dr. Ruth, you wanna unmute yourself 1 second so that I can leave my people to go to bed. It's 3 o'clock in Nigeria now, or 4.
Actually, it's 1 second. Thank you, Dr. Gordy. Thank you to all the panelists. I appreciate you all for this. And you all don't know the life we have saved today. And when we continue to do this together, we'll be able to achieve more. So I just want to say thank you. Happy New Year, y'all.
Thank you so much, Dr. Princess. Dr. Jane Aponye, I see your hand up. Are you want to say something?
Yeah. Okay. I have been patiently listening. It's been an awesome night. I cannot say more. They've all said it all, but I just want to acknowledge our host, Missy Fato, because if she's not doing well presenting this, probably would have been having some glitches. She did a very good job, and I want us to, going forward, I don't know if we should make her a part of our association. And I know I don't want to take too much of our time because everything has been said. You did a very good job being the first one. That I wouldn't honestly say there are visible flaws, but in everything there is room to grow. From the moderator, Dr. Julia, Dr. Gaji, and our very own, I don't know, most of you wasn't there when we started, but Dr. Nkwadom, when we started together, you did an awesome job. And to those of you, Dr. Ngozi and Dr. Julia Hankerson, all of you did an awesome job. And of course, you know, our president is something else. Thank you, Dr. Liche, and thank you to all of you. I honestly, I'm a very big critic. And not that I came to critique, but I was so impressed. Thank you. And I look forward to more of this. Like I said there, our biggest challenge is our leaders will never give us a chance to come. So we are talking to ourselves here. Yes. I pray and hope that someday we will permeate and penetrate, be able to give them help. And since we have just started, we want to also pay attention to our people here. People don't believe. Somebody said we are in denial, totally in denial. We don't want to believe that we have mental health, even in our own private rooms and bedrooms. But like the moderator said, it is okay to be abnormal.
and then we move on to look for the normalcy. Nobody's perfect. There is no human being that is perfect. Even when Jesus Christ, for those of you who are Christians, when he came to this world to save us, he first of all did something that he told that he was sick. How could you allow a prostitute to touch you? And he was able to tell them, if you think you're free from whatever you think she's done, yours could be in a different form, touch or throw the first stone. Nobody could do that. So we are all sick in one way or the other. Like, in short, I don't want to start calling names. People have nailed it completely. Honestly, when I attended the Info 9th, probably I wasn't really worried, but there I was a little asking Dr. Azubike, are we sure we're ready for this? He said, don't worry, it will be fine. That I know we will put things together.
That's
And
part
honestly,
of the
I have been.
anxiety. That's part of anxiety that comes with whatever, and it's normal.
It's very, very normal. And you can see me, I was calling him since day before yesterday. So my own mental health, I think I need some Lorazepam to relax me.
It's
But
okay.
it's okay. Thank you all very much. I do appreciate.
Dr.
Thank you.
Bonye, Julia, for just responding to Ifat, do you know how Cardinalize became a priest? Because he was following the white man who was a priest in his place.
Ifat is one of us.
Ifat is already one of us.
Yeah,
so
she's one of us. So she's one of us. Yeah.
Okay, I'm so sorry. You know, like I've been quite away for too long.
You're late, Dr. Bonye, but it's
Yeah.
okay too, right? Yes, Sister Francisca, I see your hand up. Since you're still up, you know, we can give you 1 second before you go to bed. I see your.
Yes, I just want to say a big thank you to all the panelists and all the people who contributed in one way or the other this night or this morning. So I'm so proud of our association, and I pray that as we have presented this one today, the future discussions will really help our people and help us to grow further. Thank you very much, and good morning to everyone.
Thank you, sister. So in closing, I just want to give a special thank you to Dr. Julia, my namesake. We appreciate your input. We appreciate every single one of the panelists. We are all international speakers. I know all of you. So I'm not worried when we put in this together because I know, you know, it's something we do every time. So I'm happy to be part of this session. And we wish this organization, baby organization, well. And Dr. Alice, we couldn't have been here, you know, without your leadership. So on behalf of my humble self and everybody, we appreciate you, sir, and we appreciate all our participants that tuned in from all over the world. You know, thank you so much. Thank you, thank you, thank you. Our own Miss Ifat, if you have any music you want to put for us, you can put it. So if anybody wants to stay and listen to the music, that's fine. And otherwise, we say thank you so much for, you know, each and every one of you.
Okay. Wonderful event. Okay, I'll play some music. Feel free to listen for a while before we end the evening. All right.
Yes, ma'am.
Mr. President. Okay.
Yeah, I thought so. Good job, absolute good job. Okay, and
No.
good night.
Good night. Bye
Yeah,
bye. Okay.
good night to everybody. Thanks a lot.
All
All
right,
the
yeah.
ones.
Very good job working the charts. Thanks.
Thank you all.
All right, okay.
No.
All right, bye bye. Thank you.
Okay, good
Good
night,
night.
everybody.